Good afternoon, good evening, colleagues. Thank you for joining us. I would like to turn the floor over to my colleague, Glenn Pierce-Oros, Senior Director of International Relations and Special Projects from SEforALL. Glenn, the floor is yours.
Thank you very much, Carolyn. And good morning, good afternoon, good evening to everyone who's joined this Energy Ministerial Side event. On behalf of Sustainable Energy for All, it's my pleasure to welcome you to this important conversation, which will lead us to energy compacts for health facility electrification. I'd like to start by just making note of one very important reality, which is that according to the WHO's operational bulletin of this week, released on June 20th, cases in Africa are surging over 20% week on week in terms of COVID-19. And this is important because the flip side of this reality is that approximately 12 million people are vaccinated in Africa as of today. This is only less than 1% of the African population. There is so much more to do in terms of the current pandemic, and there is so much more to do in terms of electrification of health facilities that will be an important part of how we address, as a global community, this global pandemic. There is a lot of momentum now, and part of our challenge is how we translate that momentum into action. And it's action around powering healthcare that is not necessarily a new challenge. In fact, SEforALL has been working on powering healthcare for many years now. But it is around how do we get more clinics electrified as quickly as possible, given the urgencies of the day. SEforALL approaches this through focusing on coordination of efforts, on market analysis, and most importantly, on data. And for this, we're very pleased to be partnering with an important partner, USAID's Power Africa, which is a funder of SEforALL as well. And with Power Africa, we hope to be able to stimulate this discussion on what an energy compact for health facility electrification looks like. We would hope, as with all of the energy compacts, we would hope to start focusing on a clear set of activities, some very clear funding commitments, and finally, an ambitious target of facilities to be electrified with a time-bound target date. It's up to us to translate this momentum into action. We think we have a very good start through this partnership, and it's my pleasure to now turn the floor over to Mark Corrado, the coordinator for USAID's Power Africa. Mark.
Glenn, thank you very much for the kind introduction. Super excited to be here, be part of the high-level dialogue on energy, and as a participant in the working group on energy access. Very excited. I'm going to make one small correction, not because I'm a stickler for detail, but because I think it's an important one. It's the U.S. government's Power Africa initiative. USAID is the chair, and we certainly contribute funds of our own and do a lot through a coordinator's office. But boy, it's the other 11 agencies that make it work as well. So from USTDA to MCC to state to DOE to USADF and on, it's really important to know that the partnership is, I think, what we're really excited about. And then the partnership also goes to the 19 development agencies as well as 160 partners. One of those entities is SEforALL, who we not only have direct connections with, but of course is a leader in this space that we're super proud to partner with. So, thanks to you and Damilola and the whole team, we're excited to take on this particular area with you in terms of healthcare electrification, because like you, we see the absolute need to bolster the efforts we've been doing as well, but not nearly to the level that we needed to, and certainly something like COVID unfortunately puts that in a spotlight in a way that is hard. And as you said, boy, the new numbers The idea that maybe Africa had missed part of this being walloped and now seeing the numbers across the continent not looking great. The need for this work is more critical than ever. So excited to be part of that. I guess what I would start by saying is, like SEforALL, and I think hopefully we live up to the rhetoric as much as others, that we're prioritizing the delivery of electricity to healthcare. We don't want to prioritize talking about it. We don't want to prioritize the planning around it, though we need to do all that well. We need to make sure that all of us, ourselves included, hold ourselves to a level of account to try to get as many of these healthcare clinics and facilities electrified as quickly as possible. So, we believe that the pandemic, that our work is critical to helping the partner countries respond to the health crisis, boost self-reliance for economic recovery, and ensure that recovery is both green and clean. So we have a lot of North Stars these days. We're following them all. Luckily, they're all mutually reinforcing and often aligned. So we can do all this. We can build back a better world as the US and the G7 has recently talked about. We can do that with green technologies, and for the most part, we can do that in a way that will both boost our health electrification we're talking about today. So, just quickly in terms of a little bit of backstory, within weeks of our response to COVID-19, Power Africa also began reprioritizing funding. In fact, it happened to be, I think I came into Power Africa about 2 weeks after we no longer went to the office. So very, very beginning of COVID-19. And we immediately set up a task force. We immediately decided that we would look at opportunity costs. We knew we would prioritize this, even if it meant some other key goals might be slightly delayed, because we knew how important this was. And unfortunately, we were right in the sense that we all still have situations where we're sitting in our own homes, not being able to go out there and do the stuff we know we need to do to get this done in an easier way. But undeterred, like everyone else, we programmed some money already, $7.2 million to date. We did this for kind of three main areas, looking at the financial viability of the off-grid sector overall. I think at the very beginning, in particular, we were concerned that working capital would dry up in what's a very competitive space. We did this overall looking at just the health and utility of the utility sector. So knowing the utilities had to continue to keep the tough decisions they had probably previously made in terms of cost-reflective tariffs, to make sure they were doing the reforms they needed, both in transparency and procurement, to make sure they kept going forward, to have that sustainable energy we all know is critical to energy access in the long run, but was threatened by COVID and the anomaly of trying to take on a global pandemic for any number of reasons we already know. And the last one, of course, is what we're doing here today. We quickly looked at load sheds or loads in terms of where the hospitals were, what districts and utilities we were supporting, and then what we could do more. And the idea here was that we think there has to be some sort of concerted effort to get after the 100,000 or more clinics and facilities that don't have electrification. And I often take this back to a very personal level for me, as a parent, as a parent or a friend or a spouse or a partner or anything, God forbid something happens to someone you care about. The last thing you want to do is roll up to a health clinic and not have power for any number of reasons, especially during COVID. Whether you're rolling in to wonder if you potentially have malaria or COVID, or you need a telemedicine consult, or whether you're expecting mom and you need a checkup or delivering a baby. There's so many reasons we need to make sure that access, and the definition to access includes access to healthcare. It's the same as it includes access to small medium enterprise and education and everything else. But healthcare certainly is one we're looking at right now. One thing we immediately did was last summer is we did a $2.6 million competition on one of our programs that tried to look at how we would look at this differently. And by that, I mean, what kind of pilots could we put out there to both actually get numbers of clinics? So they're not just pilots. So we have targets in terms of how many clinics we want to do with the original money, but we also wanted to figure out a way to better fund it. How do you crowd in private sector capital? What Power Africa always is looking to do. How do you crowd in their sustainability, their innovation, to make sure that the models that are coming out brings the right capital and know-how into it in a way that we all know is tricky. It's hard to work with healthcare facilities. Often they're poorly run or have under-resourced for sure. And we see this over and over again. So how do we change that model? So we did that. We awarded 9 companies who are looking at 250 facilities in 9 countries. And they're all being powered by renewable energy, by the way, and trying to figure out how we can take that information and then put it out to a larger effort. That effort, we started in looking on this interest through what we call a request for information, an RFI. where we want to solicit feedback from interested parties on scaling up this to be a much more large scale. Now going after those big numbers we talked about before. And so to do that, we had this request for information, and now we're looking under some of our authorities to figure out how we crowd in the best ideas. And hopefully people are raising their hands and saying, hey, we want to be part of this. We want to figure out with resources. We want to commit to resources. We want to commit to our know-how. We want to commit our business systems. And we're hoping a lot of these are private sector players that have other reasons and business cases to be part of the solution. And that's, I think, absolutely critical. So, and I should also mention, of course, because we're very proud and it's very germane to this partnership here, is that we also signed a $1 million grant with you all, with Sustainable Energy for All, to coordinate donor efforts and national plans around health facility electrification in 3 priority countries. We talked about very early, I remember a very early conversation with Damilola and the World Bank, where he said, we got to make sure we work together. We got to make sure this is too big. There's not enough time or to waste. There's not enough resources to squander. We got to make sure we're concerted. We're not duplicative in the very, very least, but we figure out a way to make sure we coordinate as we go forward. And this is part of that effort. And we're very proud that you all can take on some of that role with your unique standing. So where are we at now? We're talking about needs for a compact. We're talking about needs to have enhanced ambitions and a more coordinated approach to electrifying health facilities and actionable steps as we go forward. So we're very excited with you, our partners. We're hoping to expand our HFE efforts, as I mentioned, to be part of a larger partnership. So partnerships within partnerships, as it were. We hope that together, all of us can mobilize somewhere in the neighborhood of $350 million, maybe electrify 20,000 health clinics. This would be a massive step change. It's still not enough by any means, but boy, would it be a massive chunk in the right direction. And hopefully then would also be a very good demonstrative effect to further crowd in that partnership. Hopefully success begets success, and people soon want to buy on and be part of what would be truly, I think, one of the true callings of our time, to respond to what is absolutely mind-boggling phenomena that we're all at home still and struggling with mortality rates and sickness rates and all this at such a level. We can be part of that solution. We'd be absolutely proud to do so. So we know this, like I said, this is only a fraction, but we also know it's a solid start. If we prioritize the poorest and the most rural facilities, we also know will help make tremendous progress toward SDG 7, which, as we all know, with the high-level dialogue is the reason we're all here. The first one in 40 years, this is absolutely an opportune moment to capitalize on the potential for collective action. And we're excited about that. So hopefully all the stakeholders listening and others will catch the spirit, become part of this, commit to doing actionable stuff, commit to making sure this is tangible as we move forward. And I think if we can get those rural health clinics and in particular the life-saving equipment that's needed, including refrigeration and cold chain storage and the rest, we can save hundreds, if not thousands of lives. And that is absolutely critical. So in the words of SEforALL, we need to be bold. We need to join efforts and move forward together to ensure that sub-Saharan Africa can both respond and recover quickly from COVID, and ensure that universal access to affordable, reliable, and modern energy solutions are there for all. And with that, I'll stop. I look forward to the conversation. A lot of innovative minds have been on this. Let's solve this problem. We can do it.
Thanks, Carolyn. Thanks, Mark. Thanks, Glenn. You're excused to continue with your busy days, your afternoons, your evenings. But many thanks for those words, for raising the ambition, for getting everybody excited. I'm going to run us through hopefully not too dry of a presentation. I'm going to keep it very, very short. It's just a handful of slides, which my colleague will put up in a second. Great. So here we are. This is really just a preliminary overview of what we believe an energy compact on health facility electrification could look like. It doesn't mean that this is what it will end up look like or what it has to look like. This is more just out of some preliminary conversations with some of you, and hopefully in the next couple of weeks, consultations with all of you, we can understand how we could best shape health facility electrification energy compact. Perhaps task one is to find a better acronym for that, because it's quite a mouthful to keep on saying health facility electrification energy compact. Next slide, please. And we'll skip to the next one as well. See, we're going through this quite quickly already. So So very quickly for background, for those of you who are coming cold into the high-level dialogue, ministerial meetings, and the high-level dialogue and the energy compacts, there's a bit of text here. We'll share this presentation with you. All of this is also available on the UN Energy website. But ultimately, what we're all aiming for across SDG 7 and to be honest, also across SDG 13 on climate, we're looking for the development of energy compacts, which are ultimately voluntary commitments from member states, from non-state actors. Think of private sector, think of civil society, cities as well. Multi-stakeholder groups and consortium are also very much invited to come together either along a thematic area, along a geographic area, to submit a compact. And a compact is really there to raise ambition, to raise commitments, to raise ambition. So that's why we're also together here today to see how we can use an energy compact, not just to develop one, but to actually develop it and then the day after actually use it and see how we can use that to our own advantage for advocacy purposes, for monitoring purposes, to see whether we are on track and where we see a lot of action and where we're seeing a lack of action. Next slide, please. And we'll skip to the next one. Thank you so much. So very quickly for background, I hope all of you, definitely most of you, are familiar with these numbers. Some of them are outdated. We are working actively with partners such as WHO, World Bank, IRENA, and others to update them, to provide a new baseline to understand how many health facilities are we really talking about, how many are unelectrified, how many are under-electrified, how many are unreliably electrified, so that we can also better understand what the size of the gap is and how far we still have to go. But the collection of these numbers, however imperfect they are, clearly do show that we have a big gap. We have a gap, it's big, it's both on access, it's on reliability. But I guess the good news is, once we figure out how big it is, we can fill this gap. We can actually bridge this energy divide, because we're not talking about millions and millions of health facilities here. This is a fairly limited sample that hopefully jointly with collective action, we can provide with reliable power. Next slide. Great. So on to the subject of the main meal of the day, and that's around the discussion on an energy compact for health facility electrification. So clearly we're seeing a lot of momentum. We're collectively still struggling to turn it into action, as Glenn already mentioned. It is very timely. We're seeing a lot of interest. We're seeing a lot of increased coordination amongst many partners, seeing many new partners into this space as well, both from the energy side as well as from the health side, which we're very excited to see, of course. We just 2 weeks ago had a launch of a strategic roadmap under HEPA, which is the Health and Energy Platform for Action. We can provide the link in the chat here later. But there are many things that are happening which really work well in parallel, or that we can now build on to develop this energy compact, which, as Glenn laid out as well, essentially we see it with a threefold objective. One is identifying a set of prioritized activities. Two is providing a joint target, and three is kind of expressing that into what is the need, what is the gap between the commitments that we have and the ambition that we have. Next slide. Great. So this is essentially the skeleton, the structure of what a compact could look like along these three pillars. So the first pillar is more around activities, support commitment, enabling environment to lead to the next two pillars. So this is where we can talk more about data. Commitments are like, I want to contribute to data, I'm doing this, I'm doing that, whether it's impact data or baseline data on the number of clinics, whether it's repayment data, ability to pay, etc., whether it's more information around finance mechanisms. You know, we have some people in the audience here who are exploring different business models, different delivery models, different payment options, results-based financing, performance-based financing, et cetera, carbon markets, and actually leveraging those. If we figure out how to do that, could be another massive opportunity. So all that is kind of bucket one. Bucket two is then we actually need to put a dollar amount against this. So this is where, just kind of a little bit out of the blue, definitely back of the envelope, or back of the post-it note calculation of let's set out a big number. I'm not saying this is the number that we will end on. I just wanted to put a number here to present to you to say, what if we collectively are able to raise this amount, leading up to then that third pillar of the pipeline of health facilities, which is, of course, essentially the last point that we need to get to is health facilities electrified? And in doing so, in essentially aggregating our pipelines, it doesn't mean nobody's going to force all the different agencies to work together and to go to all the clinics together. It's more about kind of raising the ambition and saying, look at this, there are 20,000 clinics that need immediate action. Let's get a solution to them. We all have our own way of working. I don't think anyone is trying to change that. It's more about how can we take advantage of all the action that we all have and turn that into something collective, into a joint target, into an advocacy movement, or into a good source essentially for monitoring progress. We have some small text here in the bottom. I'm not going to go into that now. I'll probably come back to it when we get to the Q&A in terms of like how certain contributions could be part of this, to help you also as for yourself, for your organization, to better understand how your organization could potentially join this type of energy compact. Let's just quickly move to the next slide, which, we're only starting with this. We're very much at the beginning. Clearly, our aim is to add logos to this slide, to get your commitments, to get your ambition, and to put that down. And I'm purposefully using words like commitment and ambition because we all acknowledge that no one here on this call can say, oh, like in 2027, I will have $20 million available to electrify another 5,000 clinics. We need to find a good balance between what are we currently committing to, what is in our work plans, how can we capture that, and then how can we also capture down the ambition that we have, the ambition to electrify 5,000 clinics, the ambition to electrify every clinic in East Africa, whatever it is, or every medical cold chain in a particular area, whatever your commitment and your ambition is, let's try to find a way to capture that. And then also to capture the gap between the two, because that ultimately will become some kind of a resource need that we can also express through a compact. Next slide, please. Great. We could skip to the next slide as well. There we go. This is my last slide, and then I'll stop talking. Then we'll use all the rest of the time for moderated Q&A. But I just wanted to show where we are today, June 24th. Time is flying. We're at the midway point of the year already. And the high-level dialogue is happening around mid-September, I think tentatively the 20th of September. So in between today and now, we have a roadmap. We have a road that we need to travel together. It will have multiple milestones or markers along the way that we will want to set up, together with all of you, especially if you raise your hand and say, yes, I'm in, or very likely we'll just assume that you're in, tacit consent, and you'll have to opt out. But essentially what we'll want to work towards is, on the basis of the discussions today, of the questions that we get from you, on the concerns that you may have, on the ideas that you have, refine this type of presentation, send it around once more, and then actively go into more of a co-creation meeting, if you will, or meetings, plural, to also accommodate multiple time zones. I know it's late for EU Africa base. It's even later for South Asia, Southeast Asia. So we'll try to accommodate that much more, of course, and we'll try to provide these opportunities for either one-on-one consultations to understand, like, how can we make sure that your activities, your commitments, your ambitions are captured. And we'll start doing that very quickly after today, with our hope of already setting up a first of these consultation meetings the week after next, so the week of July 5th. More information forthcoming, of course, but I did want to flag that as another opportunity to, if we don't get to your questions today, there will be plenty of other opportunities. And then, just given the timeline that we have, there is the desire to submit an early draft of an energy compact by early August, to also give the UN Energy Review Committee the time to go through it and to see where things need to be tweaked or can be added, can be strengthened in the run-up to the high-level dialogue. So that's my last slide. if we can just quickly go to that slide, so you can just quickly write down any email address that you need, but we'll post them later as well if you want to get more information. My colleague Kanika is on the line as well. Towards the end of the Q&A, we'll happily turn it over briefly to her. She's leading all things compact, all things UN energy, so you may have some questions for her as well. But with that being said, I think we can probably just exactly close the presentation. I'll ask my USAID colleagues here, maybe David, to quickly turn on his camera as well. David will help co-MC the moderated Q&A now. And I encourage all of you to, of course, use the chat or use the Q&A, ask your questions, but raise your hand. Like, this is not for me to talk. This is not for David. This is really for all of you to just ask your questions, or, you know, if we're feeling optimistic here, validate what we're doing and say, this sounds interesting. Count us in for these next rounds. So I hope that you all have a raise your hand function in the Zoom client that you're currently using. If so, feel free to use it. I will also probably randomly or not so randomly call on a few people. One second, we're getting some background noise here. Can we mute? Excellent, thank you. Great. So reiterating again, like, please raise your hand if you have any contribution at this point, any question for us. We have a good half hour, even a little bit more, to go through them. And as I said, otherwise I will happily unrandomly ask for a few of our friends and colleagues to speak up. I'll give it. There we go. I see a hand that's being raised from Raluca. Can we unmute Raluca, please, from the World Bank?
My name is Raluca Golumbeanu. I'm a coordinator of improving livelihoods and human capital development in ESMAP, the World Bank. So just a couple of points regarding the World Bank actually involvement in tackling this important challenge, and then I have a few suggestions and where we stand on the compact in general at this point. So as you may know, the World Bank committed this fiscal year about $12 billion as COVID response through health projects at MPAs, and in addition, more than $150 million through the energy projects, particularly focused on electrification, on sustainable electrification and cold chain development. In addition to financing, of course, the internal dialogue and external partnerships have been critical actually in pursuing this COVID response agenda this fiscal year. And we'll truly, we supported very much the HEPA platform and the WHO leadership in launching this call for action quite recently. So, as you know, our leadership at the actually managing director level, it's having constant dialogue with the SEforALL leadership on how the World Bank is shaping its compacts and our position, given actually that we do have some constraints related to basically to our governance, right? So basically, in principle, we can't commit to targets and to especially to funds for the next 5-10 years to a specific topic. We are in discussions, how we address actually this particular challenge that is not only related to this issue, it's related to all the complex issues of energy access compact in general. That being said, we definitely very much would like to see, besides financing, a stronger focus on also knowledge exchange, which is really critical actually, right? Especially on this particular topic to ensure the sustainability part, right? To ensure the sustainable electrification, sustainable business models, and the role of HEPA in this respect. So basically, this is I would like to emphasize at this point. Definitely we'll continue our conversation, to see how we can further move towards, specific commitments in terms of numbers. And we are working with WHO and SEforALL and IRENA on this report actually on, electrification public institutions, where the World Bank is committed basically to assess the investment gap. So we are working on this, and we'll have some, basically some more less or scientific, basically data in this respect. But yeah, definitely I wanted to let you know where we stand at this moment actually with the compacts in general. So and we'll keep the conversation on this particular issue, which is so important actually, the electrification of more than 1 billion people that currently have access, are served by health facilities that they do not have access to electricity. Thank you very much.
Thanks so much, Raluc, and very helpful and good to know, to be reminded of the massive investment that the World Bank has put in and continues to put into this space, directly and indirectly. We're asking Paul to join us on stage as well, Paul Needham, who I assume will briefly mention some DREX initiative that he is instrumental in leading. Paul, floor is yours.
Yes, thank you, Luke, and everyone. This is such an important and frankly exciting initiative to mobilize action from so many different stakeholders towards this goal. Yeah, so I'm here, I'm Paul Needham. I'm representing the DREC initiative. DREC stands for Distributed Renewable Energy Certification. This is a multi-stakeholder, not-for-profit, private sector-led initiative to create a link between our goal 13 and goal 7, a link between climate action and access to sustainable energy for all. There really feels to be a massive opportunity here to link corporate climate ambition to financing the end to energy poverty. And we're very keen to work with you on this initiative. We've already been engaging with a number of corporates who are major investors in renewable energy in the developed world and are keen to explore how they could begin doing more investing in emerging markets in renewable energy. And one of the barriers that's preventing global corporates from investing in renewable energy in developing countries today is that there's no real mechanism or incentive, because they are not able to count their investments in renewable energy towards their climate goals, their net zero targets, or their otherwise stated climate ambitions. So that's an area that we're working on, and very keen to work with this compact to help mobilize corporate action to accelerate the energy transition.
Excellent, thanks, Paul. And yeah, I see some questions coming in through the Q&A, so please continue doing that. Also ask questions to the other participants that are speaking up, of course, if you want to ask for more information. Otherwise, I'm looking through the attendee list, seeing if somebody else wants to make a quick intervention. There we go. Raksha, go ahead. We'll bring you over to main stage. Raksha from UNICEF.
Thank you very much for putting together this side event and the idea of Energy Compact. Absolutely support from UNICEF's side. Also, as you know, we have been engaging, like bilaterally and like through other forums and platforms on healthcare facility electrification. So from UNICEF's side, like absolutely, we have full support. Just a couple of things that, to reiterate and emphasize that you have already mentioned in your presentation is, first and foremost, like as an agency who's been leading quite a bit of work, like and decades of experience in the health sector, we feel that the data that, that you've also mentioned, the dearth of data, and most importantly, I think the data sharing issue, if that could be somehow, like brought to the forefront and, like presented as one of the core priorities for commitment or call for action, I think that would be great, because we see that even though, I mean, there are countries where, like data is there, perhaps scattered, and they need to be consolidated, but the data is there. And where there is data, we have seen that perhaps the appetite or, there might be several reasons in terms of why we are not sharing the data. I think that is something that really needs to be put, like front and center. and we should find, some ways of addressing that between, ministries, Ministry of Energy and Health Ministry, also, like amongst development partners, and how we can really, as a coherent piece move together in terms of data sharing, and also, as Raluca mentioned, in terms of knowledge sharing and co-creating that knowledge and evidence itself. So I think data is a critical piece, and data sharing is even more a critical piece. In terms of the level of ambition, it's great to see, like 300 million. But I think, going by what we have seen, also, like if we're looking at going beyond concessional financing, looking at, investment, private sector, I believe, if we're talking about raising the ambition, perhaps it could be raised a little bit more. So I just wanted to, like for now, mention a couple of things. Just to give a little bit of a background in terms of what UNICEF is doing on clean energy, particularly on solar in the health sector. As you know, like we have been leading the procurement and distribution of COVID vaccine along with our partners on behalf of the Gavi Alliance for, and, like solar has been, and decentralized energy has been one of the key solutions, particularly in hard to reach places, in marginalized areas. So this is something that we would really like to build upon, and also going by, years of experience in terms of using solar direct drives and solar refrigeration for vaccine, but also now going beyond that, we are looking at comprehensive, electrification of healthcare facilities, but UNICEF's, like niche area, as we would recognize, is, as I said, more in terms of enabling conditions and looking into the data in terms of, and also looking into the assessment. So I think those are some of the, like key areas that I wanted to highlight. Again, as we also our leaders also, like they have reiterated in the recent HEPA high level coalition, we would be very happy to come in as a partner and a big supporter. So thank you so much for the opportunity, Luke, and over to you.
Thanks so much, Raksha. And yeah, we just put that number of $350 million a little bit out of the blue, but you just raised it. You have the winning bid now. I assume you said about $500 million. So let's see if somebody wants to put in a higher number in for today's meeting. I'll quickly turn it over to your UN colleague Matteo Solomon at UNDP, and then I see David, you've unmuted. So Matteo, we'll go to you first. David, then we'll go to you.
Thank you very much, Luke, and thank you, colleagues from SEforALL and USAID, for organizing this side event and leading this collective commitment towards raising the ambition for electrification of health facilities. We're very supportive of this effort, and this is also an effort we want to promote, and that we are ourselves seeking to increase our interventions in electrification of health facilities. It's good to see so many familiar faces also, and Paul that discussed on the DREX initiative. We're actually exploring a pilot project jointly in a country in sub-Saharan Africa to test out the model of the DREX to support the operation and maintenance of health facilities that have been electrified by UNDP. So this is an interesting mechanisms that we can further explore. Just as a brief background, as UNDP, we have been working on electrifying health facilities since 2017, and now have electrified over 900 health facilities. So already an important initial effort, although it's still a drop in the ocean compared to the needs. And furthermore, we recognize that we need to explore alternative business model and financial model to support the electrification of health facilities, moving away from a grant-only approach to an approach that can involve and engage the private sector, not only to mobilize additional capital and investment towards the electrification of health facilities, but also to ensure the long-term sustainability of the systems that are being installed. And this is an element that I think is very important in this call for commitment and ambition to ensure that long-term funding can be provided in this effort and move away from a grant-only approach that provide capital subsidy for the purchase of solar assets to electrify health facilities, and look into energy as a service models that can ensure long-term sustainability and reliable and affordable service to health facilities. This is an effort in which we are engaged and are looking at implementing different business models and operational model in the new set of health facilities that we are seeking to electrify in sub-Saharan Africa, and are currently structuring a program with this approach. So we'll be looking forward to join efforts with additional partner in such an important effort to electrify health facilities, and in looking in this alternative business model. So thank you very much again for the invitation, and looking forward to advance in this collective energy compact.
I'm Emily McAteer, CEO and General Distributed Energy Initiatives. And in the past year, we've really been focusing on the health sector, primarily through our partnership with the Rockefeller Foundation and the Shell Foundation on the Powering Health platform that we launched last year. So in terms of our engagement with the compact, the work that we've been doing over the past year and a half, it really does cross-cut many of the goals that were defined here. So, first is through the Powering Health platform, we've been using our platform to manage and standardize data really across the life cycle of a health electrification initiative. And so, from that baseline data that was presented earlier through to monitoring projects that have been deployed and really trying to understand how are they performing and which business models are working and aren't working. Standardizing this data across initiatives will be very essential, and using a standardized data framework to do so, we feel is one of the most important things that we can do to really learn how to deploy successful projects. And then secondly, as a financing platform, we are working to play our role in enabling large scale and innovative types of finance into these projects, be it through a call for proposals that we launched a few months ago at the Shell Foundation, specifically around exploring projects with innovative financing mechanisms to get health centers electrified, or we're exploring technology angles with DREX and DREX that we can support as well, to really bring new types of finance into the fold to get projects off the ground. I will say, if we want data on health centers, the most important thing we can do is get financial commitments to get these projects built, right? Because we need the projects built, we need them generating data, and then we need enough data that we can start to learn from that. So that's my plug for the funders that are on the call today. But we're very much looking forward to learning how our platform can support the compact in tracking project needs, in scaling up financing mechanisms, and overall measuring the impact of these financing mechanisms.
Excellent, thanks, Emily. Very happy to hear how you're already proactively thinking about how your solution can be a good contribution to the Energy Compact. I'll switch gears a little bit here, and I'd like to turn it over to Laura Stachel, who most of us know, who's been doing this for much longer than probably any of us on this call. So whenever Laura speaks, I listen. Laura, the floor is yours.
Thank you, Luke. I am the executive director and co-founder of We Care Solar. I'm also a physician. I've been working at this intersection of renewable energy and health since about 2010, when we founded our organization, We Care Solar. And we first started working with SEforALL in about 2011-12 to try and really infuse the importance of health as one of the pillars of SEforALL. And I couldn't be more excited with what you're doing now, Luke, and your colleagues. It's exactly what's needed right now, is this type of coalition and major commitment. I just want to say, through our organization, We have had a primary focus on maternal child health. I'm an obstetrician by trade, and we've always wanted to make sure that women can have safe deliveries. And we've done that through disseminating and designing a pre-wired, robust, and compact solar electric system to health facilities that has been primarily focused on maternal and child health in delivery rooms, as well as in operating theaters to allow for C-sections. Through our programs, we've reached about 6,000 public health facilities, and we have financial commitments for at least 2,000 more. And I wanted to alert people to our initiative called Light Every Birth, which is basically very similar to this compact, saying that women and newborns need to be front and center when we're thinking about healthcare electrification. And we've been eager to be part of this type of a large coalition. But the other thing I want to say is what we all know, that the technology alone isn't enough. We also focus very much on training people locally, and actually on uplifting women as solar installers and technicians in this sector. I think these opportunities are really ones where we can bring together many of the sustainable development goals. Gender equity can be part of this, healthcare, energy. We've talked about climate action. So I'm very eager to work with people here on this. And I think the challenges that we have been seeing, through our Light Every Birth initiative, we are now working at the country level, doing assessments of every health facility at the country level. And the first 4 countries we've worked with is Zimbabwe, Uganda, Liberia, and Sierra Leone. And I'd say some of the challenges that we face are in really, how do we work with governments to make sure they can take ownership of these? What are the finance mechanisms to make sure these programs can be sustained over time? And we are working to build capacity within the healthcare technician sector of these countries so that we don't just drop in solutions and not provide the local capacity for long-term sustainability. So I'd say the training and the financing are going to be sort of the challenges here for how we can make this work and sustain for a long time. But I'm thrilled to see this happening, and thanks to all of you who put this together.
Thanks so much, Laura, for those kind words, and keep up the good fight. It's the impact you've already achieved is tremendous, and I know your ambitions are much larger still. I see a hands being raised by Jeff from CLASP, so we'll try to get Jeff onto the main stage, because what something that Jeff will answer hopefully is how we can stop talking so much about solar PV and start talking about energy efficient appliances in the same breath. Jeff, the floor is yours.
Hi, thanks so much, Luke. And it's great to listen into this conversation so far and see, a lot of folks that we've been working with over the past couple of years, and also hear some new perspectives. First of all, a little bit of context about CLASP. We're an NGO based in Washington, D.C. We're appliance specialists. So we do lots of work on basically building markets for highly energy efficient and high quality appliances in both grid connected and off-grid settings. And we recently published a report that's focused on basically, it basically makes a case for, the need to develop a new generation of medical equipment that is highly energy efficient and is built for use in, what are oftentimes very harsh operating environments. We have sort of our core theory of change in the off-grid and energy access space in general is that highly energy efficient, and durable, purpose-built and designed appliances allow you to do a lot more in terms of energy service with a relatively limited amount of energy supply. We had sort of an idea that the same dynamics would likely play out in clinical settings across the global South, in particular off-grid clinical settings. And we spent the last 6 or 7 months talking with practitioners, clinicians, medical equipment suppliers, and we're able to confirm this, that there's basically a real lack of supply of equipment that's been appropriately designed. Frankly, there's a statistic that we found in our research that says, I believe it's from the WHO, that 70% of medical devices in the global South in general don't even function. So there's a need for, in addition to the very sophisticated and targeted work that an amazing work that Laura is doing in We Care Solar, I think there's a need for interventions much higher up in the supply chain to really advocate, for the development of this new generation of off-grid appropriate and highly energy efficient medical equipment. And if we're able to catalyze that, then I think the whole conversation about clinic electrification it has the potential to change. You can think about a clinic energy system providing a very holistic suite of healthcare services in a cost-effective way with appropriately sized energy systems. And so, I'll put the link to our report in the chat. We're ready and willing to talk to anybody who might be interested in the equipment and medical device piece of the broader clinic electrification challenge. We know there's a lot of barriers to this kind of transformation in the design and the supply chain for medical equipment, but we'd love to get involved and help folks figure out how we can maybe start solving some of them. So thanks a lot, and I'll turn it back to you, Luke.
Thanks so much, Jeff. And as I wait for perhaps 2 or 3 more questions that we have time for, quick incentive, if you raise your hand, we bump you to main stage and you can stay here and join us all on main stage. It's quite fun up here. I'm looking to see people smiling. I'm just checking through the attendee list to see if anybody else is raising their hand. In the meantime, people already on main stage as well. If there's still a question or a contribution that you want to make, feel free to. We want to make sure that this is especially a forum where you can also ask a question in terms of these compacts, what are they really for? Is this just a document that we're just going to sit on? The answer is no, of course. I believe Mark did mention it in his keynote that we have a strategic and funding partnership with USAID Power Africa, which is really focused on sector coordination, on market intelligence. So in that sense, we do have the bandwidth, the capacity, the mandate essentially to make sure that the most important day of the high-level dialogue, which is the day after, that we're able to push this through, that we're able to follow this, that we can use this compact, update it when necessary, when we get new data, when we get new commitments, or scale it back as well if that's what's needed. But that we do have some kind of a baseline and a track record of what is the type of ambition that we have, and that we can essentially extract from the sector in an aggregated way, in a collective way. I'm looking here to my virtual left, right, and north and south, and not really seeing any more movement. I'll hand it over to my co-host David. David, do you have any other reflections from Power Africa's side in terms of what is currently in the immediate pipeline on your end? Not to put you on the spot, but to put you on the spot a little bit.
Clinical electrification is going to be an enduring focus for Power Africa. I think that's one thing that bears repeating. I know that Coordinator Corrado touched on that, but I think it bears repeating that this is not something that caught our attention as a result of the pandemic and will fade once the pandemic fades. This is an area where we feel we can have a lasting impact. So we're very excited to be in a leadership role in the assembly of this compact, and we're eager for input from all of you. There was a question in the chat that I think was quite important. It was from Deborah Kornland from SIDA from Sweden, and it regarded whether this electrification activity would focus on renewable energy. And the answer is, in practice, yes, really. And I think that too is an important facet to bring out of all of this. We're talking about clinical electrification, but we're talking about using renewable technologies in order to make that happen. And that's simply driven by market forces. These are the technologies that offer the lowest cost and the best performance. So bear that in mind when you think about this initiative and how it will unfold. These clinics will be electrified substantially by renewable energy capacity. One thing that I found, let's call it stirring, about the remarks that we heard today, one thing that really jumped out to me was something that Luke said, perhaps in passing, but this too bears repeating, that there is a finite number of clinics out here that urgently need our attention, on the order of 100,000. which makes this challenge daunting. 100,000 is an awfully big number, but it does have boundaries around it. And to me, that's very exciting when we work, as all of us do in one respect or another. In electrification enterprises, often those numbers are orders of magnitude larger. Here, I think we have an opportunity to address a problem that has a human kind of scale to it. That excites me, and it gives me a lot of motivation as we think about some of these near-term horizons that the compact will have, hitting these goals in the coming years, not in the coming decades. So look, speaking only for myself, I very much look forward to working with all of you in whatever capacity, whether it's formally as part of this compact or in some other capacity, toward these goals that I know we all share. Over.
Thanks, David. Great to hear all that, and happy to hear and to rehear and to hear it as often as we have to, that this is an enduring priority for Power Africa. Raksha, you've raised your hand again, for which many thanks. So we'll gladly turn it back to you.
I'll try to turn on my microphone, the video this time.
We can see you.
Thank you so much. Hi. I see that we are already about to close, and I don't want to take a lot of time. But one of the important points, I think, like colleagues here and Luke, you also brought up, is in terms of intersectoral coordination, right? I think that is also one of the challenges that we have been experiencing, and how can we crack that? Especially with regards the energy fraternity and the health fraternity, and this is a question I keep on asking myself, and I keep on asking like everyone that I get to meet, especially like discussing these issues, is electrification of healthcare facility. Who is accountable for it? Is this the Ministry of Health? Is this the Energy Fraternity, Ministry of Energy? Or, as we have said time and again, there should be a long-term commitment and a coordinated joint action. I think, because of all the excellent work that SEforALL, World Bank, and partners have done over the years, we have now started seeing, that there is a lot of buy-in at the highest level. At the the health fraternity, Ministry of Health, for instance, we also saw lots of call for action and commitment at the HEPA coalition meeting last time. But when it gets translated, or if at all it gets translated at the technical level, and how we should translate that at a technical level and at the country level, and also amongst the development partners, I think it's the same issue. So I think that is something that really needs to be prioritized, perhaps as part of the compact or otherwise. And I also wanted to share a similar experience in WASH. For example, like solar water pumping is a mainstream technology in WASH now. And how did we get there, right? Like, I mean, UNICEF has been, using solar in WASH for the last 30 years. And we don't anymore talk about intersectoral coordination because, the piece has been cracked. And similarly also for solar in cold chain. I think this is an excellent example that we can also draw from for like solar direct drive, solar refrigeration in the vaccine cold chain. It has been quite a successful example, to a certain extent, if I may say so. So I think these are also some of the initiatives, some of the programs, and experience that we may want to draw upon as we build this compact. So I just want to stop there. Thanks a lot.
Excellent, Raksha. Thank you so much. We asked one more colleague to join us on stage. It's Rahul Srinivasan from the World Bank. Just again showing how, kind of testifying what Raksha already mentioned, is intersectoral coordination, health and energy, public and private. Like on stage today, we have civil society, private sector, multilaterals. I'm not sure who else we're missing at this point. We have a nice little sample size of this ecosystem. But Rahul, feel free to take the stage here.
Thank you, Luke, and again, thank you to all the organizers of this very important event. I just wanted to compliment my colleague Raluca, who made an intervention at the start. So for those who don't know me, Rahul Srinivasan, Energy Specialist at the World Bank. I work very closely with Raluca on our agenda on electrification of health facilities. I just wanted to mention that apart from all the massive investments that the World Bank has been making in electrification of health facilities, two things which we've really focused on are A, how do we do this in a holistic manner? So not only looking at electrification of health facilities, but also looking at energy efficiency, both from a passive and active standpoint. So right now, a lot of the projects that we've supported, Raluca spoke about in the excess of $20 million that we've provided in grants, and then the concessional loans in millions of dollars. A lot of this is being considered in a holistic manner, where we are encouraging our client countries to also look at passive and active energy efficiency measures to reduce the carbon footprint. So when I say active measures, that obviously links to equipment, a bit what Jeff mentioned, but also passive measures in terms of how do you look at insulation of built infrastructure that actually houses cold chain equipment. And I think we've been very clear from the onset of the COVID pandemic that even vaccine storage centers are health facilities. I think previously we would think more in terms of places where you would test patients or treat patients, but I think today it's worthwhile to consider that health facilities also include built infrastructure that houses cold chain equipment. So we have to look at energy efficiency too, apart from solarization of health facilities. We've been helping our health teams in Mongolia, for instance, in designing a climate-friendly green central vaccine cold store that looks at insulation of the building, looks at how doors are oriented, how windows are oriented. And to be honest, I think we also look at this as a chance to deal with the two biggest crises of our times, COVID-19 as well as climate change. Paul spoke about DREX, but I think it's extremely important for us to make sure that whatever interventions we are making in the COVID-19 space or in the electrification of health facility space is being done with a keen focus on sustainability and climate change. So all our support is not only focused, as I mentioned, on renewable energy, but also on energy efficiency and every other intervention that keeps an eye on dealing with both of these crises. I would say the gravest crisis of our times, COVID-19 and climate change. Over.
COVID-19 and climate change, yeah. A double whammy, to say it a little bit less elegantly. I'll turn it over to my colleague Kanika now, who I briefly introduced as our UN Energy central focal point for all things to do with compacts, with everything going on in the UN Energy ecosystem. Kanika, why don't you just very quickly in a medium-sized nutshell, tell everyone like, what should they expect? What have we seen to date on the on the high-level dialogue ministerial, and especially what should they expect? How can we make sure that everyone on this call feels like actually this compact, it is relevant for me. I want to step in on an existing compact. I want to develop my own. Like I want to be part of this movement.
Yeah. Thank you so much, Luke, and thank you to everyone who's joined this discussion today. And I think it's been really, the kind of support that's been forthcoming, and also the effort to kind of streamline existing efforts and then together scale that up into something that can take on the twin challenges, as Rahul just identified them, right, of COVID-19 and climate change. And I think the one thing that COVID-19 has taught us is that existential threats are real. And they're not somewhere in the future, they're here and now. So when the UN General Assembly actually mandated this high-level dialogue on energy in 2019, we didn't know this would be the scenario. But it was already bad enough that after 40 years, there was going to be a high-level convening on energy. The last one was in the wake of the oil crisis. And so in 2019, we were already facing another energy crisis, one that's much more deeply entrenched. And COVID has, of course, as we heard from Glenn, Mark, and everybody else, that it's just exacerbated that crisis. Many more people are slipping back into energy poverty, and the intersections of energy and development have become much more profound and clear. And I think that they were always, for people living with these realities, it was always understood that energy is not just a lever for climate action, but very much a lever also of development, delivery of development services. And so I think keeping this in mind, this high-level dialogue is a huge opportunity for us to really kind of explore and showcase leadership in all of the different kind of aspects and realms of energy and what that means, but also think about what are the short-term steps, what are the immediate actions that we need to take today in order to deliver on our long-term goals. It's all very well and good to say by 2050, we are going to do this or we're going to do that. But I think the energy compacts are a way to focus on actions, and actions have a few unique qualities. One is very simple to collaborate on actions. And we heard a bit of this before around, whose job is it really? But when it is a set of actions, I think it's very, very easy to kind of divvy up, who's going to do what. And that's why these multi-stakeholder compacts can actually be very highly effective. The energy compacts also have a very simple monitoring and review mechanism, which will hold us all accountable, even though these are not legal documents. But it is important to kind of measure our own progress on indicators that we identify for ourselves. But it is also really important to think about actions as what is replicable. And while there are several of us who've come together today to have this discussion around, say, health facilities in a particular part of the world, there will still be others that can learn from this experience. And the detailed energy compacts can actually allow this kind of replicability. The energy transition in different parts of the world is all going to look quite distinct and unique from each other. But there may be actions that are common, whether it is in Indonesia, whether it is in Ghana, whether it is in Brazil, and the same things could be required or with slight tweaks that they can be made fit for purpose. So I feel like it's an opportunity for us to really kind of address these twin challenges, as we heard, both around COVID, but also around climate change. It's also an opportunity for us to put out there ambitious actions that can then be supported. There are several, whether it's philanthropy, whether it's donor countries, whether it's private sector organizations who want to act more decisively, who want to support the shift, but they don't necessarily always know how. And so the Energy Compact also kind of offers, in a way, an advanced market signal about the actions that are intended and planned, and others can join. They can support it financially, they can support it with technical expertise, as well as with scaling and capacity building. And the Energy Compacts also are in a way, a matchmaking mechanism where countries can kind of make offers of support or requests for support. And so if you as a collective put out an offer of support of electrifying, X thousand healthcare facilities each year or each quarter, there are governments that need that kind of support that can reach out to you. And the legitimacy of the UN process can facilitate that kind of matchmaking in a way that's efficient, where we're able to accelerate the pace because we're not spending a lot of time getting country buy-in and building those relationships from scratch. So there is a value addition rather than just grandstanding and making commitments. There is something that actually accelerates the pace at which we deliver on the goals that we have already agreed on globally. So I'm really very heartened with this conversation. I'd like to thank everyone that's participated so actively, but also especially Power Africa, USAID, and SEforALL, but specifically Luke on shepherding this process. And we really look forward to a robust energy compact with all of you represented in all, because we're not building from scratch. We're standing on the shoulders of all that you've already done to look further ahead faster. Over.
Excellent. Thanks, Kanika. Thanks so much. I'll quickly turn it over for a final minute from my USAID colleagues here. I think David, are you taking the final minute? Is Caroline? Go ahead, and then I'll take us home after that.
I suppose I can just quickly say that there's not much that I could say. Following Kanika's call to action, I think that was motivating and a great summary of what we were all here to discuss. On behalf of USAID, I'd just like to thank SEforALL for the privilege of contributing to the dialogue today, and to thank all of you for attending, for this opportunity to continue the conversation with so many of you and to engage in the conversation for the first time with others. We have a lot to discuss, but beyond discussion, we have a lot of work to do. So I'm personally and we institutionally are very much looking forward to the opportunity to carry this forward. Looking forward to getting to work. Thank you.
Thanks, David. We're going to end a minute ahead of schedule, the first time in the history of side events. So like a little pat on the shoulder here. Thanks all for joining. I'm just putting my contact details here in the chat. Reach out if you think this is something you want to get involved in. We would be happy have more conversations, more consultations, capture your commitments. Many thanks to all of you who spoke up today, who asked questions. This is just the start, a long way to go until the high-level dialogue, but we hope that we can build that compact with all of you together. Big thanks to my colleagues. Big thanks to Power Africa for co-organizing and for joining us here today, and for really showing a lot of leadership, which is just absolutely amazing to see. Thanks for the organizers as well, of course, but especially my colleagues who are here backstage, who often do a tremendous amount of work that goes unseen. But the fact that this all happened without any glitches, we should applaud it. We should welcome it. So thanks to everyone backstage. And with that, I'll give you a few seconds back in your day. Use them wisely, and we'll be in touch. We'll have a weekend first, Monday morning. We'll be in touch. We'll see you then.